Good evening, ladies and gentlemen. My name is Dr. Mekella Mehmet Yesil. This evening I'd like to talk about cervical cancer and the workplace. As part of an ongoing project to do with mental health awareness and obviously the psychology behind it, I'd like to discuss a subject that's quite dear to me for many reasons, and obviously during these unprecedented times it's quite crucial for women to basically go to their GP and have a smear test. In doing so, sometimes the results we plan to receive are not the ones we anticipated receiving, and sometimes that can have a negative impact on our health and our self-esteem. So therefore we have the situation where we have to tell our loved ones at home and also the people that we work with, because that's where we spend a majority of our time, in the workplace. So it's also quite important that to have a balance of making people understand that you come first, your health comes first, your safety at work comes first, and also your well-being at home with your partner and your family environment. What I'd like to say is that if during the unprecedented times that we're actually encountering in 2020 at the moment, you're finding it difficult to go to your GP and get a smear test, then obviously do press for it, because it is absolutely paramount, because that test could prevent a negative impact later on. Don't leave it unattended. If you are due, ring up your GP, get an appointment, go to your smear test. That's one of the things anyway. On the second note I'd like to say is, if having discovered you've had a smear test and it comes back negative and you have to go back to have a second, what we call a biopsy, that's going to have a detrimental effect on your well-being, again, both at work and at home place. The way to deal with it is speak to employers, make them understand you've had this situation, you're not sure what's going to happen, you're worried about the level of the illness and how it's going to affect you being at work. Talk to people, let them know how you feel. Most employers will be accommodating to the fact that there is something there, and they can put things in place to help you feel more comfortable, more reassured. They can be more observant of your health, and obviously make time for you to leave to go to other hospital appointments or clinic appointments. That's absolutely paramount, no doubt about it. On that note, taking in the advice or taking in the information that there could be an element of cancer, what we call malignant cells, is going to have a detrimental effect on that person, that individual, and that individual needs to take time to understand what's happening, why it's happening, and how they can move forward with diagnosis and treatment. And again, during these crucial times, people worry about going to hospital. They have a psychological worry that if they go to hospital they're going to catch something or bring something home or what have you. But don't stress with that, because there are different relevant departments and clinical clinics that can test and do treatment for the individual. So that's nothing to worry about there. But what I would like to say is that diet, mental health, exercise, speaking to people, opening up is very, very important. It's never been more important than it is now in this day and age, especially now in 2020, which will obviously go down in history regardless. Speak to people, let them know how you feel. If there is family history of cervical cancer, speak to them. There is obviously a dominating gene, a predisposed gene that can be inherited. Treatment can take place if it's laser treatment or just taking a minor bit of surgery away from the cervix or anything like that. It's basically done in a day under a local anaesthetic. It's nothing to worry about. What we do want to prevent is it going from a 2 or a 3 to a 4, because then it gets more severe and it goes to other organs, into your blood vessels, and it can spread much more quickly, much more vast. So we want to eliminate that. And it is a lot to take in for any woman, regardless of their age, regardless of what they're going through, regardless of where they work. It could be a hairdresser, it could be a physician, it could be a beautician, it could be anybody doing any job, secretary in an office. You know, you need to take time out and to understand that, you know, things happen for a reason. We can fix it, it can be prevented, but more so it's getting up here and speaking out to somebody, letting them know how you feel. It's really, really important. And it's never too late. Never ever too late. On that note, I will just pause there for a little bit. I'll just explain. During these unprecedented times, again I'll mention it, we have to understand that everybody needs everybody. So we have to be there for one another. And we have to understand that speaking out about something doesn't mean to say that you're weak or anything like that. People do understand. People are there for you, especially the doctors and the nurses, the psychologists. Everybody is there for one another. No one's going to sort of sit back and stare or ignore you. Get it treated. Get it treated, sort it out. It will be a matter of life or death if you leave it longer, so make sure you sort it out. Radiation, laser therapy, anything, even immunotherapy, if it's so vast, and you know, chemotherapy or radiotherapy you don't want to have that, it's fine. We can prevent this illness, even more so now. 77% success rate now, even during 2020, looking at the figures. A woman doesn't have to suffer alone. She can talk to her partner, she can talk to her colleagues, she can talk to family members. It's not contagious. We can sort it, we can fix it. And obviously, again, when I say about family and history, we know that women who have type 2 diabetes are more likely to get the cervical cancer. And although it's not mainly a genetic one, it can be passed on through partners, it can be passed on through other methods as well. It doesn't have to be just through sexual intercourse. There's so much that needs to be talked about, so much, and you can talk to your nurse, your matron, whoever's in charge of your multidisciplinary team, MDT team. You can talk to them, and they're always very open and they're always very honest. And I'm pretty sure that every employer out there will make time to discuss things with you. You can discuss things with them. And mental health has never ever been so important as it has now. Really, it really is important. Thank you for watching.